One of the most common questions that I get on resident recruitment days, what opportunities are there for me if I choose to join you at the University of Minnesota in global surgery?
I think there are a number of advantages for surgical residents becoming involved with global surgery activities, either in the United States or abroad. One is they get a much better appreciation of the global burden of surgical disease. They also have a better opportunity to study another health system in which resources are limited. But also importantly, they provide teaching and education, and they may initiate and develop relations with surgeons, physicians, medical students, residents in other countries, and these relationships could benefit the host country.
So we know that there's a shortage of healthcare workers globally, and this is a greater challenge in low and middle income countries, such as Rwanda. So they don't have enough doctors or nurses or healthcare providers in this country.
The opportunities for global health at the University of Minnesota and the Department of Surgery are extensive. Some of my other colleagues have mentioned the work done in Rwanda and Honduras and other plans we have. I would add that we have a well-established project in Uganda that includes research and that includes education and includes surgical outreach that residents from the University of Minnesota can participate in throughout their career and after.
The people that I work with at my own hospital, now where I kind of worked with mostly residents, I now have colleagues who are actually former graduates who've now gone on to take leadership roles. And I see a lot of my former trainees who are now taking leadership roles within the country itself and at their different respective hospitals.
I think you come to get a sense of an appreciation of why you're doing what you're doing.
An appreciation for why we're truly doing this.
What I've been most excited about this trip so far while I've been here is seeing the way that the team works together.
I've been bringing down surgical residents and medical students from the University of Minnesota for now over 10 years. A lot of those residents now have finished all of their training, they've finished their fellowship, they've started their practices, and these former residents are now starting their own programs, and they are making a lasting impact on the lives of people in this country.
I think the reason to come back is knowing that the patients here are so appreciative for what we do. You know, you can just see it in their eyes and the way they look at us.
You actually feel like you are providing something to the patients that it is a privilege to provide.
We're able to do this because of you guys. You come and you help us. That's the only way that we can provide the best care to the patients that are born in Honduras.
I've always been passionate about global surgery, and that's always been a part of my career plan. The opportunity to be able to come here and to learn how this process works and be involved in it in multiple levels has been really important for me.
Residency is an interesting time because you have a little autonomy sometimes, but a lot of oversight. And here, our attendings have really encouraged us to take a very active role in every part of the patient's care.
These residents will have the opportunity to operate and gain the surgical experience they need to be in private practice, or independent practice rather.
Residency can be really hard, and at the end of my third year I was ready for a break. Coming here kind of reassured me that this is what I wanted to do with my life.
I hope that we can continue having some of these residents come down to Honduras, and then maybe they can become leaders, and leaders that understand the suffering of the patients that we have in the world.
I think it's been a key part of the journey. I think it got me through residency during the hardest times and gave me something to look forward to that I would be able to hopefully provide to another resident that maybe have been having the same struggles and needed to be renewed in their passion for medicine.
You know, whenever I see the Minnesota Inn, I feel like I got a lot of friends over there.